So let's look at what to be aware of if your full blood count is high or low outside of the normal values. If you have low red blood cells or low hemoglobin, this could be due to anemia. Anemia can present with symptoms of fatigue, chest pain, headaches, shortness of breath, pale complexion, depending on your race, or just looking off color. And there are many causes of anemia, such as if you're a woman, heavy periods can cause anemia. You could have iron deficiency as a result of heavy periods or due to lack of iron in your diet, as well as other deficiencies such as vitamin B12 and folic acid deficiency can all be causes of anemia. Other genetic conditions such as thalassemia can also cause anemia. But your anemia can also be due to an underlying cancer. Cancers can cause inflammation in the body, reducing the production of red blood cells, such as leukemia, or blood loss, such as in bowel cancer. If you have high hemoglobin, this could be due to a rare type of blood cancer called polycythaemia rubra, which can cause the bone marrow to produce too many red blood cells, which can cause a risk of strokes, heart attacks, and blood clots. High hemoglobin levels are also found in kidneys and liver cancer. If you have a white cell count, this can be due to inflammation, infection, and allergies, but can be due to cancers of the bone marrow such as leukemia, lymphoma, and myeloma, which can cause the body to produce too many white blood cells. A low white blood cell count can also be caused by bone marrow cancers, as these abnormal cells prevent the bone marrow from producing white blood cells. Low platelet count, also known as thrombocytopenia, can also be due to bone marrow cancers, which prevent the body from producing enough platelets. High platelet count, known as thrombocytosis, can be due to gene mutation, infection, inflammation, iron deficiency, but can be due to cancers such as lung cancers, bowel cancers, oesophageal cancer, breast, and ovarian cancers. So if you're doing blood tests and you notice you might have high or low values, do not ignore these results. Speak to your doctor to find out the significance. Also, do not rely exclusively on blood tests, as you can have a normal blood test and still have cancer. And remember, you cannot go by one-off results. This would usually mean repeating a blood test to see if these results are still abnormal. If you have symptoms suggestive of cancer, then you might need to undergo further tests such as further blood tests, stool tests, x-rays, CT scans, MRI, endoscopy, which is a camera test that goes through the mouth and through the bowel, and several other investigations depending on your symptoms. And remember that an abnormal full blood count can also be due to other causes as I mentioned, and in some cases there is no specific cause. And do not think, oh, my white cell counts or platelets are high, so I think I've got cancer. What it means is that you need to go to your doctor and repeat the test to see what the reasons are for having a white cell count or platelet count. For example, a low hemoglobin can be due to a genetic condition called thalassemia, which is passed on through generations and usually results in lack of red blood cells and can cause symptoms of tiredness. A high hemoglobin level can be due to dehydration from diarrhea or burns, for example, or in people who smoke too much, that can cause high hemoglobin levels. So hopefully this has improved your understanding of how to spot cancer early by doing a simple blood test called a full blood count. And please, if you have any questions, drop some comments and feel free to subscribe to my channel.